I got my job offers during my rotations. I did not take them because I moved back home. It was
Would you rather manage someone's food allergies or take care of a cosmetic case?
versus big organization, you might have different physicians, different day, and some physicians love APCs and some don't. And that's okay. You're not gonna make everybody look.
How long is a training period like for someone in your role?
Also, you need to be kind of an artist because not everybody's the same. You obviously have to follow the anatomy and safety precautions.
More podcasts or create Instagram reels?
Well, we're human beings. That's what makes us, have feelings, have connections.
Welcome back to the STAT podcast, where we have conversations about the pre-PA life, PA school, and the PA you always dreamt of. Today we have Maryna Haydash. Maryna moved from Ukraine to the US when she was only 14 years old. She received her bachelor's degree in respiratory therapy from the University of Missouri, and then she worked as an RT for 4 years providing care for adult and pediatric critical care patients at Swedish Medical Center and Harborview Medical Center. She then attended West Liberty University Physician Assistant Program in Wheeling, West Virginia, to obtain her Master's of Science in Physician Assistant Studies. Then she moved back to the Seattle area and worked as a physician assistant in hospital medicine at Swedish Medical Center, where she originally worked as a respiratory therapist for 7 years. And now she works for a physician who is board certified in multiple different things. She is passionate about ENT, asthma, allergies, and cosmetic skincare. I hope you enjoy this conversation. We talk about her passions in her role currently. Most importantly, we also talk about how does it actually feel like working for big organizations versus small private practices. I hope you enjoy this episode like I did. Hey everyone, welcome back to another podcast. Today we have a PA who works for different specialties, I believe. It's just one workplace with different specialties. So Maryna, how would you describe your role to future PAs and current physician assistants?
Absolutely. So, hi, everybody. My name is Maryna Haydash. I'm a board certified physician assistant. I specialize in ear, nose, and throat and facial plastic surgery. So, the surgeon that I work for, she's a double certified in ear, nose, and throat and facial plastic surgery. So, I get medical aspect of medicine and cosmetic, a little bit more fun aspect of medicine. And we also do a lot of allergy therapy and also manage sleep apnea as well.
So I'm assuming you do like a bunch of different things, like maybe acute conditions, chronic conditions, but it's also like cosmetic
Absolutely, yeah.
care.
It does not get boring. We do a little bit of everything. I work for private practice, Dr. Becker. So we do cover quite a lot, as she is a double certified. I mentioned that before. So I do a lot of general ENT, acute cases, like you mentioned, acute sinusitis, acute ear, acute otitis media, acute allergic rhinitis, things like that, and more chronic issues like chronic pancreatitis, recurrent ear infections, that more cases that require more surgical approach.
Okay. What is your favorite part about your job? I feel like going into cosmetics, I wasn't really big fan before PA school, but like I feel like when I start researching about different roles a PA could take, I think what interests me is plastic surgery because I always like so I have a lot of loose skin around my body because of tremendous weight loss. And the only thing to get rid of it is through plastic surgery. So that's what interests me a lot. So what's your favorite part about your job?
Yeah, definitely. My favorite part of my job is cosmetics. I do love making people feel more confident, and there's something about it just making them happy when they do it for themselves, for now nobody else but themselves. Just build more confidence in people because when you feel good about yourself, you just bring more positivity around you, and it's not superficial. It makes obviously you have to feel good about yourself deep inside as well. But if you look good, you feel good. It's a combination of both. So I love making my patients feel confident. I do like the medical aspect of it too, because I feel like if I would just do cosmetics, it would get eventually somewhat boring for me. So I like the aspect that I do still medical, that I get to see my older patients who just have recurrent ear infections, or struggle with allergies or struggle with sleep apnea. It can really make a big difference. Like for sleep apnea, some people have been snoring for years, they've never been diagnosed with sleep apnea, and then we order CPAP. And then once the sleep apnea being managed, they lose weight, they feel better. And a lot of times, all the comorbidities that come with sleep apnea get better, like diabetes, hypertension. So sometimes one simple fix can make it such a big dramatic change for a patient. So I honestly love all aspects of my practice. I really enjoy allergy therapy as well. My younger son struggles with severe food allergies. So it was very stressful for me personally when he was younger. So I can imagine for all the moms up there and or dads struggling when the kids are struggling with allergies, it can be very stressful, especially if it's a severe cases that can lead to anaphylactic reaction.
Okay. One of the things that I've noticed during PA school is that ENT and immunology is really small portions of our board exams, whether it's like other standardized exams or like big board exams like end of rotation exams or the PANs. So one of the traps that we as students get into is getting a lot of those questions wrong on exams. So how would you say like we should think about ENT and allergies, whether it's like I know for you it's been a long time, but how should we approach those conditions in school and clinically, especially in clinical rotations?
Yeah, absolutely. So I was lucky enough to have rotation in ear, nose, and throat during my BA school. That helped me quite a lot on the boards. I do agree, it's such a small percent. I believe it's less than 10% on pens, and I just recently retook my pen re-LA. So obviously, exposure is the key. Unfortunately, not everybody gets to do ear, nose, and throat rotation. I think a lot of times just practicing questions, exposure, looking at the cases. I learned the best by seeing actually cases in person and practicing the questions. That being said, I was in general medicine for about 6 years before switching to specialty. And that was the reason for that, because I really want to know all the specialties as much as I can, or at least general before going into subspecialty. So I'm glad I did that because I feel like I do have a lot of general knowledge in all aspects of medicine, not just ear, nose, and throat and facial plastic surgery.
Okay. Go, Going back to cosmetic care, just one question popped up. Like, what do you really value about the medical aspect of cosmetic care, and how is it different from, let's say, like other surgical subspecialties?
Yeah, absolutely. I think cosmetics, this is the only one time in medicine that you can bring out art and medicine together. I don't think there's nowhere else in any specialty you can bring out art, but here you do. Like, let's say, doing injectables, right? Like Botox or filler or Cabela or whatever the injectable you're using, you need to know where to place it. So obviously there's potential side effects that can happen, but also you need to be kind of an artist because not everybody's the same. You obviously have to follow the anatomy and safety precautions, but it's unique because you almost like painting. You're an artist and you want to make sure that, someone's face, it turns out well. So I really like that aspect of it, that no patient's the same and you do consultation individually and you a specialist in medical field, but you're also an artist who wants to provide a good care for the patient so they look natural, but they look refreshed and youthful and
So
confident
I
in them.
Yeah, definitely. So you have to have so much knowledge about being in this role. So how does your like a average weekly schedule look like?
Yeah, so it varies just because our physician covers so much. And so just to kind of tell you a little bit about our practice. So we have one surgeon. She's the owner of the clinic and she has four APCs, three PAs, and we just hired a nurse practitioner. We all have about 15 to 20 patients a day. It kind of all depends what we see. I see a lot of post-op visits that Dr. Becker performs the surgeries for septoplasty, sinus surgery, TNAs, ear tubes. Then I see a lot of facial plastic surgery post-ops like upper blepharoplasty. My surgeon no longer does rhinoplasties and facelifts, but that would be typical the pre and post visits for that as well. Then I see a lot of allergy consultations. So new patients coming in with allergies. So I do consultation and I decide if they want to do allergy testing. We do allergy testing such as like skin testing, set testing for environmental and foods. It's on your arm usually. And then we usually see for the follow-up going over the allergy results and see if somebody can be an allergy shop candidate, and also going over like food allergy testing results, talk about elimination diet, prescribe EpiPen if they have anaphylactic type of reaction. Then I see quite a lot of imaging results too for if surgery is recommended for chronic sinus disease, things like that. Then I see cosmetic patients for upper lower face Botox, mid face fillers, lip filler. And then we do also Kybella, which is sometimes people have a little bit of fat in the chin area. It's an injectable that we put in. here.
Okay, so how many hours a week can someone expect to work if they had your position, and how does that interfere with like family life and work life balance?
Absolutely. So the biggest reason, and one of the reasons, I guess, I got this job compared to the job that I did before. So I used to work as a hospitalist, PA, general medicine, and my schedule was intense. I would have 7 12-hour shifts. So it would be 84
I
hours
heard
of
that.
work. Yeah. So it was intense and it worked out very well when I was, didn't have any kids and had a lot of freedom. But once I had kids, it was very difficult not to see my kids for like 84 hours. You work 12 hours, but then code can happen, things can happen, and you end up working 14 16 hours, sometimes just documenting from home. So I got lucky with this job because it's usually 8 to 9 hour shift. I do work 9 hour shift. It's because I prefer that. I just would rather have a little longer day and less days. But I work little bit more than part time. I work Monday, Tuesday, 9 hour shifts, and then on Wednesdays I'm off, like today. So I can be with my kids and do self care, exercise, do things around the house, cook and clean. And then on Thursdays I work 9 hour shift, and on Friday, I work only half day, so it's 7 till noon. So it's perfect because then afternoon I can have a long weekend. I can hang out with my kids. That was the biggest key for me to have that balance, the self care, being present with my children, with my husband, and do things that I love, like hiking, running, having life outside the medicine, and it's important having that balance. Very very important.
I honestly love your schedule. It sounds so comfortable.
It is. It's
But
perfect.
yeah, it's perfect. Okay. I wanted to ask you about the procedures that you can do as a PA in your role. Like, what are some of the procedures that you can do that bring you the most satisfaction and also patient satisfaction?
Yeah, absolutely. So the procedures that I do, I am able to scope patients, laryngoscopy. So we go through the nose. I can visualize the nasal passage. If I want to go all the way to the vocal cords, see if there's any signs of silent reflex, I can go all the way to a vocal cord area. So that's a big procedure that I do. I see daily, at least on few patients. Then I also do a lot of tissue biopsies. Our surgeon also has radiation therapy for skin cancer, for basal cell carcinoma and squamous cell carcinoma. So I do lots of tissue biopsies, especially like females who prefer less scarring. They prefer to see facial plastic surgery specialists. So I do quite a lot of tissue biopsies. Also, I do Botox and fillers and Kybella.
You mentioned allergies. So, what are some tough allergies to treat as a PA? I'm assuming you're 7 years out of PA school. Like, what are some complex cases you have encountered in your role?
Absolutely. Well, the most challenging probably allergies are food allergies, especially like tree nuts, peanuts. Those can unfortunately lead to anaphylaxis and people can die. Other food allergens can also, lead to anaphylaxis. You never know, like dairy, wheat, soy, those are big ones. I think the biggest challenge is elimination diet and avoid those food allergens. As I mentioned before, my younger son struggles with quite severe allergies. So it can be very, very scary because sometimes they have this adverse reaction and you don't know which way it's going to go. Do you need to use EpiPen? Do you have to call 911? And I'm in medical field and I sometimes freak out. So I can imagine non-medical people how they feel. That's the most challenging. I think sometimes not knowing what reaction you're going to get. And unfortunately, we live in America that there's a lot of processed food, a lot of contamination. Dairy is pretty much in all processed foods. My son is severely allergic to dairy. So it was very challenging because you go to McDonald's and dairy's in everything, and then 2-year-old doesn't understand he can't have that. So that's very challenging. I think it's really challenging to educate that to patients and patients family, and depending on the severity, because sometimes people just have a rash and that's pretty much it. They can take Zyrtec and they fine, and somebody unfortunately can die from anaphylactic reaction. So that, I think the food allergies are the most challenging, but environmental allergens can be really hard too, like allergic rhinitis to pollen or dust mites is huge. That's when we offer immunotherapy, when people try multiple things over the counter and you just constantly struggle with the postnasal drip congestion, and it really can affect someone's life significantly.
What are some of the skills that someone as a new grad or even someone who is trying to switch specialties and work in your role, like what are some skills that are really important to just start working on?
I think the biggest skill is communication. A
Okay.
communication skill is very important. Just you never know where you're going to get your job, and just being friendly and willing to learn and connect with people. We're human beings. That's what makes us, have feelings, have connections. I think that's a big skill to have as a student. I got my job offers during my rotations. I did not take them because I moved back home. I was out of state at the time. But it's huge because if you have connections during the rotations and there's possibility of job offer, and even if it's not right fit for you, that you can learn from that and see if you can move that to or put that in a next experience in your life. So I think communication is key and connection, and you just never know where that connection can help you in your future and in your
I've heard so much about communication stuff,
absolutely.
and it just serves as a constant reminder, even though I like hearing that. But also, what are some specific communication tips that you have probably carried out, whether it's a patient interaction or a colleague interaction? Like, what are some of your special tips, I guess?
When it comes to patient, I've been in medicine for a long time. I've been PA for 7 years. I was a respiratory therapist for like 6 years before that. I think what I realized, and I'm realizing more as I'm further into medicine, that you people really don't care about your medical degree, where you went to school, what was your GPA. No one cares about that. What they care about is they want to be heard, and to learn how to listen. And just a lot of times they don't even need you to fix them. They just want you to listen to them and to understand them. So I think that's something I'm realizing the more I'm practicing. A lot of times, unfortunately, I can't fix certain things. I can help what I can help, but a lot of times they just want to be heard. And so just ability to listen to someone and try to understand them. You might not fully understand them, but try to understand them as much as you can and just be present. And I think that goes a long way. And that's how I build some of the greatest relationships with my patients. And that comes even with the coworkers too, just being a good coworker, able to help, able to listen, but also a lot of times it's how you make people feel. That's the biggest thing. How you make people feel. Uh, Sometimes we're all about ourselves and forget how we make other people feel. But if you make feel someone uncomfortable, you make feel someone stupid or not smart enough for you, or you kind of make them feel below you, they will never go back to you for consultation. They will never go back to you for any type of treatment. They will never listen to you. You could be the smartest person in the whole world. You can have the best GPA. But if you make them feel not on your level or beneath you, or you feel like you disrespect them, they're never going to follow your orders or your prescriptions or any of that. And that comes to coworkers as well. You want to be respectful to your coworkers and
Yeah,
your peers.
thank you for this because so my rotation one was like really bad. And like 2 weeks into the rotation, I made a decision that, okay, this is a bad situation, but the only thing that it's in my control is how I treat patients. Then
Absolutely.
rotation 2 and 3 were really good. And what my issues were, okay, if I didn't know how to diagnose someone or manage someone or understand their management, I would feel about bad about myself. Instead of listening to you, I feel like what I should do is I should look back on the interaction instead of the outcome of the diagnosis or outcome of the management.
Absolutely. Absolutely.
So
Sometimes people see like five different consultants and they come to you and they don't want so much even the answer. Well, obviously, people want the answer and the diagnosis and the treatment. But sometimes I get to like patients tell me, like, wow, you're the first one who actually listened to me. You went through all my notes, you took your time. And that's what I like being a PA in our practice. I can take my time with my patients. I don't feel rushed. And a lot of times I tell them like everything's been done, all the, treatment's been done, and the diagnosis is correct, or maybe we still don't have a diagnosis, but they feel heard. I think that's the biggest thing. They want to be heard.
definitely. You currently work for a private practice. How does that differ from working for big organizations, especially like being a hospitalist?
100% different, very, very different. I work as a PA hospitalist at a big organization. A lot of it's all about how many patients you see, how many new patients you discharge, admit. It was all very calculated. Versus in private practice, I don't feel that way. Like I mentioned before, I set my time how long I want to see my patients. It's not like limited to 15 minutes only. I can extend it to 30 minutes or even 45 minutes if I need it, or even longer. I can make a block in between if I know this is going to be a difficult patient and needs more time.
I like it
Uh,
already.
so just timing management is very different. You kind of, and it all depends. Not all private practices are the same. The other big difference is that patients really get to know you in private practice better than hospitalist medicine. Hospitalist medicine patients didn't really choose me. They were there, they were sick, and I was rounding on them. Sometimes they would request me if they get readmitted, but there was an interpersonal relationship versus outpatient. They make an appointment specifically with you. So they know who they're going to see, and it's that interpersonal relationship that you build over time. And they'll just say, oh, I request this and this person. I want to see her only. And in some way, it's special because you have that unique relationship between you and your patient. When it comes to finance, I think working in bigger organization, it can give you better benefits when it comes to retirement. Unfortunately, because private practice cannot, afford those things a lot of times. So retirement can be probably better via bigger organization. And then when it comes to funds of like CMEs, continuing education, sometimes a bigger organization can have more money in that aspect versus private. It's going to be kind of case per case. But like I said, there's always pluses and minuses. I enjoy way more working for private practice. I feel like
Yeah.
I feel more special. I feel appreciated as well.
Now, I wasn't going to ask you about compensation specifically. I don't need to know what exactly do you make, but how does it differ from working for a big organization versus a private practice, for especially for PAs?
Yeah, absolutely. So for bigger organization, you might get like better bonuses and things like that, like a sign out, because they want you to sign out bonus for 5 years, they want you to be with them for 5 years or whatever it is. Sometimes they don't really make you sign certain contract, but a lot of times the bonus can be better in a bigger organization than the smaller. But sometimes you can make better hourly in a private clinic because then it's kind of per your productivity. So if you do a lot of procedures like tissue biopsies, things like that, some private practice will pay you per productivity too. So it kind of depends where you work and who's the supervising physician. I think the biggest thing too, working for bigger practice versus like a big organization versus private practice, is the physician that you work with. When you work for bigger organization, a lot of times physicians are not really, I don't want to say they not like sign up, but they're not expected to train you. So a lot of times they end up training you because that's what the bigger organization wants them to do. Versus private practice, surgeons hire PACs and they want you to teach you everything. They want to train you. So I think that's huge because you almost like their project, or they want to put in so much into you because it's private practice and you're going to be their PA, and they want to put all the knowledge into you because you're going to be with them because you're that right hand. Versus bigger organization, you might have different physicians different day, and some physicians love APCs and some don't, and that's okay. You're not going to make everybody love like you. So I think that's another thing on with the bigger organization. You're going to have a different physicians rotating, and you might have physicians who don't like APCs, and there's nothing you can do about it. You can just provide good care and be you.
What are some of the things that you have personally learned from your physician currently? Because it feels like it's more like a mentorship and they really want to teach you.
Yeah, absolutely. I mean, she taught me pretty much everything about ear, nose, and throat and facial plastic surgery. She's just amazing. She's a really good human being. I think what I learned the most about her, that you can make everybody happy. There's going to be patients who's going to be unhappy, and there's nothing you can do about it. I love the approach she takes, that she's been honest with her patients. She's very straightforward. So she taught me that you do you be the best provider you can be, and there's patients who's not going to be happy with care, and you can do excellent job. It's just there's nothing you can do. So I think that was very eye-opening for me, because in hospitalist medicine I was all about making everybody happy, and you should be making your patients happy, but not to extend going doing things that you should be feel comfortable doing it. But here I kind of finally understood that you can make everybody happy. There's people who will complain and there's nothing you can do, but you can provide the best care you can. She taught me obviously everything but ear, nose, and throat when it comes to medical care. I pretty much shadowed her for weeks. I watch her style. I see her prescription pattern and what she's doing for each, medical issue. Observe her doing surgeries. I observe her doing injectables. So it's pretty much ongoing learning, and I'm still learning. A lot of times, like, I'm seeing my patients, and sometimes I have 20 patients a day, which it can be quite busy. And I have a little break in between, and Dr. Becker's doing some kind of minor procedure that I haven't seen it yet, or I want to see it again. She just pulls me aside, hey, Maryna, come see it, or come do it with me. So she constantly teaching me more and more. And I love that because she's really investing in me. And I feel like I'm invested in her as well.
How long is a training period like for someone in your role?
Yeah, or anything, or yeah, it all varies, you know. I mean, I have to say mine was kind of intense and quick because I was a PA for 6 years, so I wasn't ear, nose, and throat, but I seen quite a lot as a hospitalist, so it was high expectation for me to pick up quick. I didn't like go to work and I had 20 patients the next day. I had maybe 3 patients, 4 patients, 5 patients, 6 patients, and I slowly build my panel, to a full. So that way if I would have a lot of time to research between the patients and pull her aside and go over things and, hey, can you look at this? Does this make sense? And also big plus was that I had other 3 PAs work there, and it's so good to work with other PAs because we still continue to learn from each other. We're not learning just from our attending physician, but we're learning from each other.
One final topic that I really want to hit on is because I will be a new grad really soon.
Yeah.
And I really like the idea of working for a physician that is board certified in multiple different things because by default, my interests are multifaceted. I'm interested in so many different things. But having that said, like being a new grad, what would you advise new grads on whether they should look for hospital type jobs or jobs in big organizations? Or if they really just want to do private practice work, like what's their best shot, in your opinion?
Honestly, there's really no wrong way of going. It's about landing a job that you will like and enjoy, or any job initially, being honest. You want to get a job. Many PAs suggested to me to go into general, and that's why I went into general because they told me it's much easier to switch from general to subspecialty or specialty versus vice versa. Like if you just do ear, nose, and throat and you want to do hospitalist medicine, it's going to be difficult because there's just so much you need to know versus if you did hospitalist medicine, internal medicine, you kind of know a little bit of everything. Then you go into subspecialty. Obviously, it's in much more depth, but at least you have that basic understanding of all the specialties, or at least some level of understanding of the other specialties. So what I've been told by other PAs when I was a new grad, go into general and then you can go into specialty. That being said, looking back right now, honestly, I don't think there's anything wrong going into specialty. I'm much more happier now than I was in general. So if I would take my time back and I would get ear, nose, and throat right away, facial plastic surgery, I would go into that as well. I think there's really no wrong way of going. You just want to go with something that feels right. And the biggest key is going to facility that's willing to teach you, and mentor you, understanding that you're completely new. This is all new. It takes months to kind of figure out your flow and sometimes years. I mean, it took me 2 years to feel okay as a PA, and then continue learning and then you continue to get better and better. It's all learning experience. And that's why it's called like practicing because we continue practicing, you always practicing.
You mentioned a really important part about being happy. What makes doing this role, like what makes you happy doing this role?
Yeah, yeah. I don't even know if the happy would be accurate word. Probably maybe content. Content would be a better word. I think I'm much more content than I was with the hospitalist medicine. I think it's that work-life balance and that inner relationship with patients, with the supervising physician, and with the coworkers, other PAs, MAs, front desk. I feel like we actually know each other. Like it's more than just work environment. So that's a huge key for me. But also that I have time off. I'm able to do things that makes me truly happy and more content, like hiking, being with my kids, being a mom, such a big part of who I am. And I think balancing that is huge. So I think finding a job that you find purpose in it, but also that you're not just working, you have life outside working. Cause I feel like when I was a hospitalist, the first 2 years, all I did just work. I work for, I would do the 7 on and then I would pick up extra shifts. So I was constantly working. And then it wasn't really life work balance. And I chose that myself. Like I wanted to pay off my loans. I was very workaholic at the time. So I worked quite a lot. And now I'm finally at a level of my life that I'm enjoying things outside work. And I think that's very important because when you enjoy things outside work, you enjoy things in your work too. And you're much happier, more content at work because you feel rested and refreshed and recharged.
I love that advice. When I think of rotations too, when I have like tough weeks, I always think of like, what have I done outside of school and rotation that I could say, okay, I'm starting to love this rotation, because I feel like a lot of times if I'm not sleeping well, I'm not going to the gym, I'm not doing things that I love, like the rotation experience sucks. So
Absolutely.
I can
Absolutely.
I can start relating that from your advice. So thank you for being on the show. I think this was really helpful. I learned a ton about
Wonderful.
little different things that we talked about. So any last bit of advice for future PAs or current PAs in your opinion?
Last advice, just be you. Be you. You're unique.
Yeah.
Everybody's unique, never try to be someone else. Connect, communicate. That what makes us as human, have feelings, being connected with patients, with people, with the other PAs, with your supervising physician. Make memories, and just be present.
Okay. If you have more time, we can do a little rapid fire.
Yeah, absolutely. I
Okay.
think that should be still
Just
okay. Yeah.
I
Yeah.
just
Yeah.
need probably 30 seconds or a
Yeah,
minute.
absolutely.
Okay, let me think some good ones. Okay. Would you rather manage someone's food allergies or take care of a cosmetic case? If you had to pick one.
Both are really good. Probably cosmetic.
Okay. Back when you just graduated PA school, would you be a hospitalist or like a position like yours right now?
That one's hard
Because
because I can
because
be
you
wherever.
paid off your loans too with all that
Yes,
working.
yes.
So yeah.
Yes, I don't regret anything, so it's hard to tell. But being honest, probably if I could get ENT job in facial plastic surgery right away, I would go that route too. But I don't regret anything.
Okay.
Sorry, I didn't really answer that.
Oh yeah, that's fine. And then would you rather do more podcasts or create Instagram reels?
Guest.
Okay. Isn't this fun? It's fun, right? And just having a conversation.
That's
Yeah.
awesome. Yeah, it is fun.
Okay. Those are things I have. 3 things, but those are the things I could think of. But thanks for being on the show. It was a fun one.
Yeah, likewise. Thank you.
Thank you. Thank you for watching, everyone. I'll catch you in another podcast. See ya.
See ya.